Dear students, welcome to our department. Our department is named Propedeutics of Internal and Children Diseases. I am Associate Professor at this department, Rəhimə Qabulova, and our first lecture is dedicated to Introduction to Propedeutics of Internal Diseases and Clinical Examination Methods of Patients. Objectives of the lecture are the following: introduction to the subject, definition of health and disease, overview of the basics of medical ethics and deontology, clinical examination methods, the history-taking, subjective examination, and physical or objective examination. Internal medicine or therapy is an area of medical science, studies etiology, pathogenesis, clinical manifestation of disease of internal organs, develops methods of the diagnostics, treatment, and prevention. Propedeutics of internal disease means introduction to internal or clinical medicine. Greek word propedeia means preliminary teaching. Object of propedeutics of internal disease is studying examination methods of patients, signs and syndromes, studying clinical manifestation of the most common diseases of internal organs. And now about the definition of notions health and disease. The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Dimensions in the concept of health. There are 4 dimensions: physical, mental, emotional, and social. These dimensions provide a full picture of health, and the change in any dimensions affect the others. This interrelationship between dimensions of health is one of the key aspects that you need to understand. The physical dimension of health refers to the bodily aspect. It refers to the more traditional definition of health as the absence of disease or injury. Physical health can affect the other dimensions of health, as a decline in physical health can result in decline in other forms of health. And now about the definition of notion of disease. Disease is a pathological condition of an organ, system, of an organism resulting from various causes of etiological factors, such as infection, genetical defects, or environmental stress, environmental factors, and characterized by a group of signs and symptoms. The study of disease is called pathology. It involves the determination of the cause or determination of etiological factors of disease and understanding of the mechanisms in development or pathogenesis, the structural change associated with disease process or morphological change, and the functional consequences or the signs and symptoms of disease. Correctly identifying the above-mentioned characteristic of disease is necessary for the proper treatment. An identification of disease from its symptoms is called medical diagnosis. A procedure followed in making medical diagnosis is called diagnostic procedure. Diagnostic procedure requires proper skills and expertise and compliance with the rules of medical ethics and deontology. Medical ethics and deontology is a very important part of medicine. It's a set of ethical standards and principles of behavior of medical workers while executing the professional duties. The medical ethics studies and defines the solution of various problems of interpersonal and mutual relationships in the basic directions. These directions are the following: the health worker and patients, health worker relatives of the patient, and the relationships between the healthcare providers. The healthcare providers' obligations lies in defending the man's physical and mental health, easing his suffering, respecting human life and dignity without discriminations related to age, sex, race, ethical affiliation, and the religion, nationality, social rank, political ideology, or any other reasons, in time of peace as well as in time of war. And what is the main ethical principle in medicine? Primum non nocere, first to not harm. The moral responsibility of health workers means the observance to all principles of medical ethics. Wrong diagnosis, treatment, and inappropriate behavior of medical staff, such as disclosure of the medical secret, refusal to give medical assistance, infringement of the patient privacy, it's inadmissible, and this is a violation of the principles of medical ethics. I'm sure that you have heard about the Hippocratic Oath. This is the ethics of historically taken by physicians. It is one of the most widely known Greek medical texts. The oath is the earliest expression of medical ethics in the Western world. It's establishing several principles of medical ethics, which remain of paramount significance today. Swearing modified nowadays and is practicing for medical graduates in many countries. In conclusion, I would like to show you an extract from the Rules of General Medical Council. And in this slide, you see the duties of a doctor. I will just articulate several of them. The care of your patient is your first concern. Treat patient as an individual and respect his dignity. Treat patients politely and considerately. Respect patient confidentiality. Work with your colleagues to serve your patient's interests best. And now we can switch to diagnostic procedure, which consists of assessment of symptoms and objective signs, as well as the results of laboratory tests. This slide demonstrates diagnostic procedure contents or diagnostic procedure stages. First is main examination, second supplementary. Main examination is divided into two stages as subjective examination, objective examination. Subjective examination is called history taking or interrogatio, which consists of taking the patient complaints, disease history anamnesis morbi, and life history anamnesis vitae. Objective examination or physical examination or assessment of the present status of the patient is also includes visual examination, palpation, percussion, auscultation, and anthropometry. Supplementary examination consists of laboratory and instrumental studies. Subjective examination starts from the taking general information about your patient. Here you see the list of data collection, and here are the all general information or past birth information about the patient. Then physician asks the patient about his complaints, the subjective symptoms of disease, as for example, as breathlessness, cough, fever, diarrhea, and these complaints also may be objective and subjective. Objective complaints are easily recognized and assessed by the physician as edema, vomiting, and subjective is not measurable, and this is just referred to the patient's own feelings. Complaints may be principal and general complaints. Chief complaints represent the patient-reported symptoms and collected at the start of visit. These describe what prompted the patient to seek care. General complaints are not specific and they can be found in many different diseases. What are the main characteristics of complaints? First is condition and time of occurrence. Second, the localization, radiation of pain, for example. The character of pain, quality and what was it like, intensity of pain, the settings in which it occurs and when it disappears, and what are the associated manifestations, for example, pain associated or pain which followed by the vomiting. This chart shows the character of pain or Socrates mnemonic, how to assess the pain. And very important to consider all these features of pain in order to get the thorough information about the symptom of disease. The next step of history taking is anamnesis morbi, or anamnesis of disease. And the main goal of this part of history taking is to reveal or clarify the character, cause, and course of disease. Which questions are important? They have shown here. First is the information about the onset of disease, the time and site of the first symptoms, causes of disease in the patient's opinion, the conditions, surroundings in which it started, and the course of disease. It is chronic or acute, and about the progression, amelioration of symptoms, and what investigations were performed, and treatment undertaken, and the effectiveness of this treatment, and the main cause of the patient's present visit. Anamnesis vitae is a history of medical biography of patient in every period of his life, his infancy, childhood, adolescence, and maturity. Collecting anamnesis begins from the general biographical information of patient, his living conditions, his marital status, his working condition, maybe the unfavorable labor conditions or industrial hazards, if any. Medical history about his past illnesses, operations, which can contribute to development of the current disease. Family history, any cardiovascular disease or diabetes mellitus or cancer in very close relatives, or any infections in the family, for example, tuberculosis or HIV infection in close relatives, heredity, any genetical diseases, allergies to food or drugs, or harmful habits as alcohol intake or alcohol abuse or drug abuse, or smoking habits of patients, which can contribute to development of current disease. The next step after subjective examination is to determine the patient's present condition or status presens by means of the following physical methods of examination: visual examination or inspection, palpation, percussion, auscultation, and anthropometry. Before starting the physical examination, it is important to do some arrangements. Take the following steps to prepare for the physical examination. First, think about your approach and how to make the patient comfortable and relaxed. Always start examination with washing your hands in the presence of the patient. And reflect on your approach to the patient. Try to appear calm, organized, and competent. Then adjust lighting and the environment. Adjust the bed to a convenient height before the examination. Then good lighting and quiet environment are very important for successful examination. Tangential lighting is optimal for structures such as the jugular veins, pulse, thyroid gland, and apical impulse examination. Make the patient comfortable. Show concern for privacy and modesty. Close the nearby doors and draw curtains before beginning if it is necessary. And also drape the patient with the gown or the draw sheet. As you learn, at first learn to do it, and it is very important to visualize one body area at a time. During examination, it's very important to keep the patient informed about your findings. When you have finished, tell the patient your general impressions and what to expect next. Another important step is choosing the sequence of examination. The sequence of examination should maximize the patient's comfort and avoid unnecessary change in position. Then the next one and the last one is observe the correct examining position. Examine the patient from the patient's right side. This is the most common used position. As I mentioned, position of patient and examiner are very important factors for successful examination, as the environment affects the quality of physical examination. It is wise to arrange for quiet and privacy, sometimes darkening of the room, and comfort of the patient and examiner. In this table, you see the different positions for patient and examiner depending on anatomical area or activity. Now you know idea about the medical ethics and deontology. You know how to approach your patients, and you have collected history. You made the history taking, this subjective examination, and now you know that how to make arrangements for physical examination. And now we are ready to start objective examination. As I mentioned before, objective examination starts with visual examination or inspection. In this slide, you see the sequence of inspection or main steps of inspection. It starts from general status, consciousness, position, and constitution. This is assessment of these features, and then defining the facial expression of patient, examination of individual parts of body, and estimation of status of skin, visible mucous membranes, subcutaneous fat, and gradually lymphatic nodes, muscles, bones, and joints. Position of the patient plays a very important role in clinical practice in diagnosing of disease. Three types of position are distinguished. Active position, when the patient is able to sit without outward help. Forced position, the patient assumes the posture, bringing him relief. And the passive position, when the patient lies motionless, completely unable to change his position without help. In this picture, you see four positions. Three of them, they're forced positions, and one patient, which is described on the right lower corner, this passive position. In this slide, you see the patient with orthopneic position. Orthopnea is condition that causes shortness of breath when the person is lying down, and the feeling is characterized by tightness in the chest and is often described as air hunger. Here, two patients, as I told you, this with orthopneic position, but first patient with bronchial asthma and second patient with acute myocardial infarction and because of this acute left ventricular failure. And these two positions are so typical for their diseases, so it is possible to diagnose disease at a first glance. Posture and gait examination gives very important information for diagnosis. Posture of healthy individual is upright, walking is springy, extremities can move freely. Sometimes abnormalities are so typical, it allows to decide about diagnosis at first glance. For example, in Parkinson's syndrome, a slight forward bending of the head and trunk is observed, and walking consists of small, often shuffling steps. This syndrome occurs in brain atherosclerosis. Hemiparesis, hemiplegia, means paralysis of extremities on the same side of the body. A mild degree is called hemiparesis, and more severe is called hemiplegia. The most severe cases of the mobility is so limited that neither standing nor walking is possible. This is mostly seen in patients with cerebral apoplexy. Ataxia with unsure walking is represented by a wide basis walking with stature. It occurs in alcohol intoxication, disorders of dorsal roots of the spinal cord, in B12 deficiency anemia. Another abnormality is called rolling or duck walking. Is present in congenital luxation of iliac joint and in myopathy. And the next step is assessment of the state of mind or assessment of the patient's consciousness. The patient's mind may be clear or confused. And here you see the 3 grades of the consciousness disturbances. First is the stupor, mental apathy is a state of stunning. In this picture you see the patient who is in stupor. Patient poorly oriented in the surrounding situation and answered the questions slowly and late. Here, the 2 patients with sopor and coma. Sopor is mental sleep and it's more pronounced consciousness disturbance. This patient doesn't react to surrounding people, but sensitivity is preserved. This patient is not able to answer the questions or give very brief answers, yes or no. The second patient in this picture, she is with coma. This is total unconsciousness. The patient doesn't react to speech addressed to him. And there is decrease of normal reflexes or disappearance of the reflexes. And you can see here the appearance of the pathologic reflexes. Next step is examination or assessment of the patient body build or constitution. Constitution is combination of the functional and morphological bodily features. They're based on the inherited and acquired properties of the body. And this is a response of the body organism to endo and exogenous factors. The classification adopted by Chernorutsky is shown in this picture. It differentiates between the following 3 main constitutional types: asthenic, hypersthenic, and normosthenic. Asthenic constitution is characterized by considerable predominance of the longitudinal over the transverse dimensions, and the patient's extremities are long. The heart and parenchymal organs are relatively small, and the intestine is short and the diaphragm is low. Arterial pressure in these patients are lower, and the vital capacity of lungs are greater. And also the adrenal and sexual functions are often decreased. And thyroid gland, there is the hyperfunction of thyroid and pituitary glands. In hypersthenic constitution, there is the predominance, relatively the predominance of the transverse over the longitudinal dimensions of the body. The trunk is relatively long and the limbs are short, the abdomen is large, and the diaphragm stands high. These patients' blood pressure is relatively higher than in normosthenics and asthenics. Hemoglobin is higher, and the secretory and absorptive function of intestine is higher. Thyroid gland is relatively hypofunctioning, and but sex and adrenal glands are highly increased. Normosthenic constitution is characterized by well-proportional makeup of the body, and this is intermediate between the asthenic and hypersthenic constitutions. And this slide demonstrates a summary of the differences between hypersthenic and asthenic patients or constitutional types. Facial expression is another important finding during visual examination, and this facial expression also allows us to put sometimes diagnoses at first glance. Just keep in your mind that there are many different kind of facial expressions specific for different diseases in the clinic of internal disease. I show here only three examples. First is facies nephritica in patient with renal defects. As you see, the patient's face is pale, puffy, and eyelids are edematose. Second is facies bizadovica, or face of patient with thyrotoxicosis, the anxious, frightened facial expression. Eyes are wide open and specific glitter and exophthalmia, or the bulging of the eyeballs. And the third is facies mitralis, the face of the patient with decompensated mitral valve disease, is characterized by cyanosis, cyanotic blush on the cheeks, and also it resembles the butterflies, so it's called mitral butterfly. Ears and eyes examination plays important role in clinical practice. Here you see signs of hyperlipidemia. First is Frank's sign. Literature indicates that there may be a relationship between diagonal earlobe crease and coronary artery disease. Second is xanthelasma, is a shallow protruding area on the eyelid close to the nose. It is caused by the accumulation of fat in the skin. The third picture represents corneal arcus, which is also a sign of high level of blood cholesterol, mostly found in elderly people. This slide demonstrates examination of neck. It includes assessment of neck muscles, lymph nodes, trachea, thyroid gland, carotid arteries, and distension of jugular veins or pulsation of jugular veins. The first picture shows dancing carotids. This is specific for aortic insufficiency. Another picture shows enlargement of lymph nodes, and the third picture, jugular vein distension, which occurs when the central venous pressure increases. Increased pressure of the superior vena cava causes the jugular vein to bulge and making it most visible in the right side of the person's neck. Examination of neck can reveal enlargement of neck because of goiter. This is an abnormal enlargement of thyroid gland. And there are three types of goiter are shown here. First is diffuse in grave disease. Two of them, they are uninodular form, and the last picture shows multinodular form of goiter. General examination of the patient is followed by inspection of skin and mucous membranes. Attention during examination should be paid to the color, humidity, elasticity, state of hair of skin, presence of rashes, hemorrhages, vascular changes. Normally, the skin color depends on the degree in which the blood is visible through the superficial layers of the skin. Change in the skin color may be due to the following three principal factors: color of the blood, the patency of the blood vessels, the thickness of the transparency of the skin. This slide demonstrates technique of examination of visible mucous membranes or palpebral conjunctiva. The picture on the left corner shows normal conjunctiva, and the picture on the right corner, it shows pale conjunctiva in the patient with anemia. Paleness of skin and mucous membranes can be found in patients with decreasing of oxyhemoglobin or decreased peripheral perfusion. The main causes of paleness are anemia, physiological in patients with fair skin, shock, hypoglycemia, and other metabolic derangements. Hyperemia, redness, can be found as a temporary redness or persistent redness. Temporary redness is specific for people after alcohol intake, atropine intoxication, in fever, after taking a hot bath, administration of vasodilating drugs, and strong emotions. Persistent redness of skin is found in patients with excessive increase of number of erythrocytes or in erythrocytosis. This slide demonstrates cyanosis or blue discoloration of skin. It may be generalized, peripheral, and local. Generalized cyanosis is inadequate arterialization of blood because of the oxygen insufficiency and excess of carbon dioxide. In this slide, this is the first patient, male patient, mostly specific for patients with respiratory system disease or lung diseases. Local cyanosis is associated with the heart diseases when the inadequate function of the heart or ventricles results in slowing down of the peripheral blood flow, and the tissues intensively absorb oxygen from the blood and saturate it with the carbon dioxide. And the third picture demonstrates the local cyanosis. It is typical for patients with disease of peripheral veins. Jaundice or icterus is yellowish discoloration of tissues. It is caused by increased plasma concentration of bilirubin. According to the cause, the following types of icterus can be distinguished: prehepatic or hemolytic, hepatic, hepatocellular, posthepatic or obstructive. Jaundice is seen if values of bilirubin exceeds 3 milligrams deciliter. And the bilirubin has high affinity to elastin-rich tissues, sclera, skin, frenulum of tongue, so it is best seen at palate, under surface of tongue, and clearly detected in daylight. Skin complaints are common in clinical exams and everyday practice. The cutaneous signs can be also very vital in identifying diseases of internal organs. With structured examination technique and the knowledge of terminology, skin signs can be described and classified systematically. Skin cancers are increasing in prevalence, and if detected early, treatment may be effective. So it is very crucial to differentiate between benign and malignant pigmentations. Pigmentation of the skin may be found as freckles, birthmarks, pregnancy, spots, with intensified pigmentation in the nipples and median line of the abdomen. The second picture represents the pigmentation typical for vitiligo. Here are two more examples of hyperpigmentation and depigmentation of skin. The first example is Addison disease. It manifests by diffuse skin hyperpigmentation, except palms and soles. Addison disease, also called adrenal insufficiency, which decreased cortisol and aldosterone. And the second picture shows albinism. It is caused by lack of pigmentation in skin, hair, and irises. Hair and irises have light colors, so the pupils seem to be bright red. Scars are also can be found in different cases as marks of the previous operations and traumas. In this picture, you see the scars from open cholecystectomy or after appendectomy or laparoscopic surgery, thyroid gland surgery. During the physical examination, all cutaneous abnormalities should be noted using appropriate morphologic descriptive terms. Skin lesions can be described as follows: macular, papular, nodule, vesicle, bulla, postal, wale, and scales fissure. This table shows differences between different skin lesions and the morphologic description. Different morphological elements can be found in skin examination. Here you see 4 examples. First is xanthoma. This is accumulation of fat in the skin, and this is specific for the hypercholesterolemia. Second one is purpura or petechia, presence of small hemorrhages in the skin, often associated with bleeding from body cavities and tissues. It occurs as a result of failure of hemostasis, which is maybe caused by damage of the wall of small arterial vessels or capillary bed and in vitamin deficiency. It can be found in decreasing of thrombocytes or the thrombocytopenia, in other words. And another picture shows spider angiomata, and this is specific for usually are found for patients with hepatic cirrhosis in liver disease, especially in patients with alcoholic liver cirrhosis. Hematoma has its origin in substantial subcutaneous bleeding in case of, for example, coagulopathy. And they gradually discolorize over time and can be found in patients with hemophilia, in anticoagulant therapy, in trauma and hepatic cirrhosis. Assessment of skin elasticity also included in the general examination. It is easy to take the skin elasticity test. Just pinch the skin on the back of the patient's hand with your thumb and forefinger and hold for several seconds. Release it and check the time, how long it takes for skin to flatten back out. The shorter the time, the younger the functional age of the skin, and it shows the normal hydration of the skin. Assessment of nails. This examination is useful in diagnosing of internal conditions and skin diseases. In chronic iron deficiency, the nails become brittle, flat, and eventually spoon-shaped or coiling-here. White nails, here, are sign of the hypoalbuminemia. You can see here the many examples of brittle nails and the change in nail. And we will talk about this change during our further lectures and during practical classes as well. Here is example of change of fingernails and toenails. Also fingers shape are changed and it looks like the drumsticks. This condition is called clubbing. It may result from the chronic low blood oxygen levels. It can be seen with cystic fibrosis in congenital cyanotic heart disease and several other diseases. The tips of the fingers enlarge and the nails become extremely curved, as it's shown in this picture. And the clubbed fingers can be found, as I told you, in heart disease or lung disease, but also in the chronic disease of liver and in some chronic inflammatory diseases. Weight is an important indicator of general health and nutrition. Serial weight measurements are useful in monitoring acutely ill patients and those with chronic disease. Body mass index, rather than the weight alone, is independent the patient's height, and it's more informative in assessment of the obesity. Body mass index is calculated from the formula weight divided to the square root of the height, and obesity is defined by body mass index. It must be more than 25. More than 25 it's overweight, and more than 29 is obesity. Body mass index doesn't describe body fat distribution, and excess intra-abdominal fat is independent predictor of hypertension, insulin resistance, or type 2 diabetes and coronary artery disease. In this picture you see the apple shape and pear shape fat distribution or accumulation of fat, and apple shape is the intra-abdominal increasing of the intra-abdominal fat, and as I told you, this is the risk factor of many diseases. In this picture you see how to test the body fat with skin-fold caliper. The skin-fold caliper is a device which measures the thickness of fold of your skin with underlying layer of fat. By doing this at the key location can be quite accurate representative of the total amount of fat in the patient's body. It is also possible to estimate the total percent of body fat of the body. Here you see how to assess the body fat with skin folder in the waist region. And body fat testing with skin fold caliper is carried out also in the different regions, in other regions of the body. Subcutaneous fat tissue examination is followed by assessment of edema. Edema may be sign of cardiovascular, liver, endocrine system diseases. Pitting and non-pitting edemas are distinguished. Non-pitting edemas are specific for hyperfunction of thyroid gland. Pitting edema is specific for cardiovascular, liver, and kidney diseases. And this edema results from pressure applied over edematous subcutaneous tissue, resulting in depressed area caused by the displacement of interstitial fluid, as it's shown in this picture. The next step after assessment of subcutaneous fat tissue is examination of lymph nodes. They may be palpable in normal people, especially in submandibular, axillary, and groin region. Pathological lymphadenopathy or pathology of lymph nodes may be local or generalized. And it is of diagnostic and prognostic significance, especially in malignancies. To palpate, physicians use the pads of 4 fingertips because they are the sensitive parts of hands, and examine both sides at the same time or symmetrically. The major groups of lymph nodes and order of the examination is shown in this picture. When examining the lymph nodes, the following characteristic should be noted. First is size, if they are enlarged or not, painfulness or tenderness, consistency, matting or fusing, also location, if they are localized or generalized. Take into account during examination that infected lymph nodes, they are tender, they're painful. Malignant lymph nodes, they are firm, non-tender, they are fused and fixed, and they increased in size. Examination of the musculoskeletal system is included in the medical examination. Patient must be asked to expose the parts of the body in order to have the general idea about the development of musculoskeletal system and to reveal the possible pathologies. Joint-related complaints are rather common, and understanding anatomy and physiology of both normal function and pathologic conditions is important when evaluating the symptomatic patient. Detailed descriptions of the shoulders, knees, spine, they can be required as these are the most commonly affected areas. Deformities of vertebral column, as scoliosis, kyphosis, kyphoscoliosis, deformities of small and large joints can provide important information for diagnostics. In this picture, you see the patients with kyphosis, kyphoscoliosis, and also deformities of the finger joints. During examination, the physician must carefully inspect the joints in question. Are there signs of inflammation or injury, swelling, redness, worms, deformities? Many joints are symmetric, so the joints must be examined in compare with the other or healthy side. Assess the range of motions, also active and passive motions. In the setting of injury and pain, it is often difficult to assess the joint because patient protects the affected area and limiting movements and examination. Examination of muscles and bones also give an important information and idea on the patient's muscular development, cerebral hemorrhage, local traumas, and tumors of the brain. Muscular strength, tone, and tenderness must be examined. Palpation of bones may reveal the tenderness, deformities, and traumas as well. Sometimes malignancies of internal organs cause metastasis to the bones and it causes fractures. And now in brief about the palpation, the second step of objective examination. Palpation is a method of examination based on the senses of touch and temperature of physician. Physician presses on the surface of the body and determines temperature, humidity, elasticity of skin, painful regions, also size, shape, fixity, location of underneath organs and tissues. The two kinds of palpation are distinguished, the superficial and deep. Superficial abdominal examination or superficial palpation is gentle, a light examination when physician's hand lays flat on the abdominal wall and inspects the abdominal wall with light touches. The goal of this examination is to reveal the adhesion of linea alba, hernias of abdominal wall, tenderness, which produces local voluntary tensing or guarding. Also, involuntary reflex contraction or rigidity also can be found. This is related to the external pressure and it indicates the peritoneal inflammation or peritonitis. Guarding and rigidity may be in general or localized. It also shows the stage and severity of peritonitis. Deep palpation allows to identify abnormal organs and masses. Sometimes only one hand or right hand, but sometimes both hands can be used for this examination. And the technique is when one hand or two hands are pressed more deeply than in gentle superficial palpation. Identifying the shape and size of each structure by compressing them through the anterior abdominal wall onto the firm posterior wall is the main goal of this palpation. When examining a mass or specific organ, note the size, shape, surface, consistency, and any associated tenderness of the organs. Percussion was suggested as a method of objective examination by Austrian physician Leopold Aumbrucker in 1762. And percussion is the art of striking a surface part of the body with short, abrupt taps to diagnose the condition of the parts beneath the sound. And in 1762, Leopold Aumbrucker, he published the book, A New Discovery that enables the physician from the percussion of human thorax to detect the disease hidden within the chest. On the importance of this discovery, Aumbrucker is considered one of the founders of the modern medicine. Immediate and mediate percussion are distinguished. Immediate percussion is performed by three half-bent fingers pressed to each other, and this method is called Aumbrucker's method. Janowski method percussion with index finger, and Obraztsov suggests by the method of percussion with index finger, the edge of which is fixed on the middle finger and then slipped and tapped the part on the examination. And these two methods are mostly used in pediatric practice. In the 19th century, special tools called hammer, plexer, and pleximeter, the special metal plate, were applied for mediate percussion. And later, pleximeter and plexer were displaced by the physician's or examiner's fingers. In this method, in this technique, finger strokes at another finger applied to the body. A bent third finger of the right hand strikes the third finger of the left hand at the second phalanx. It must be firmly placed on the body, and finger strikes should be perpendicular, abrupt, very quick, and applied by a free. This slide demonstrates the two techniques, correct and wrong techniques of performing percussion. On the left side, you see the correct position of fingers and correct direction of strikes. Percussion is a method based on physical factors, as different substances, when struck gently, give out vibrations with a variable frequency, depending on characteristic of the tissue. Percussion strokes ought to be of equal force, because strong strokes elicit loud sounds, and weak strokes soft sounds. That is why, depending on the force, two kinds of percussions are distinguished: loud or deep, and quiet or superficial. In a loud percussion, the vibration of the tissues examined extend up to 6-8 centimeters deep and 4-6 centimeters wide. Quiet percussion reaches depths of 4-5 centimeters and width of 2-3 centimeters. And depending on these methods, during percussion, using loud or the quiet percussion, we can reach the deep or superficial organs. Percussion sounds may be loud or clear, soft or dull, high-pitched and low-pitched, tympanic and non-tympanic. This slide demonstrates an iconic image of percussion sounds. They may be high or low in pitch, depending on the frequency of vibrations in a vibrating body. The greater the vibration frequency, the higher the sound pitch. A high-pitched sound is at the same time short and soft, while a low-pitched sound is loud and long. For example, high-pitched, short and soft sound is found over the liver or muscles, while low-pitched and loud and long sound is found over the air-containing organs as lungs or stomach or intestines. Under the normal conditions, a clear sound is heard on percussion of the chest in a region with air-filled cavity. A soft sound is produced on percussion, air-free organs, and soft tissues as heart, liver, muscles, and spleen. This picture demonstrates percussion notes and their characteristics, with all characteristics as intensity, relative pitch, relative duration, and also example of location. For example, the flatness is heard or is found over the thigh, over the thigh muscles, or dullness is found over the liver. This is the relative intensity is medium, is relative pitch is medium, and relative duration is medium. For example, tympanic sound is loud, is high-pitched, and this duration is longer and is found over the gastric air bubble. This picture demonstrates a different part of body and specific percussion sound for every part. For example, resonant sound in blue, it shows normal lung. Dullness and flatness are shown in red. This is specific for thigh and liver. And tympanic sound is shown in green, which is specific for gastric air bubble or intestine. Remember
that air-containing organs produce loud, low-pitched and prolonged sounds. Air-free organs produce dull, high-pitched and short sounds. Depending on the aim of percussion, comparative and topographic percussions are distinguished. Comparative percussion is used for compare the symmetrical organs and is performed over the symmetrical areas of the body. Topographic percussion carried out according to the difference between the air-containing and solid tissues and used for determine the size, shape, borders of internal organs. About the main rules of percussion, the first step is preparing the environment and patient. Examination requires a quiet area. It requires the area of percussion to be exposed. Second is positioning of the patient. The optimal position for chest percussion is sitting in a chair or on the side of the bed. Sometimes position lying at 45-degree angle may be required. You may need help to support the patient in a comfortable position during the examination. And the next step is the procedure of percussion. On topographic percussion, the pleximeter finger should be placed parallel to the border of the organ to be percussed. The line of percussion should be perpendicular to the border of the organ. The pleximeter finger should be placed firmly over the body surface, and there should not be air between the finger and the body surface. Percussion should always be done from a resonant sound to dull area. During percussion, the movement should take place at the wrist joint only. In this picture, you see comparative percussion of paired organs, lungs, and the position of the physician's hands during this percussion. Auscultation is objective examination method aimed for assessment of sounds generated within the body, generally for the purpose of diagnosis of disease. It may be done directly with the unaided ear. It is called immediate auscultation, or with a stethoscope, and is called mediate auscultation. Auscultation allows to reveal respiratory sounds, heart sounds, clicks and murmurs, sound over the abdomen, abnormalities aorta and arteries. This method was suggested by the French physician René Laennec in 1816. He was the leading French internist of his time. As his colleagues at that time, he tried to figure out what was going on inside the human body by placing an ear directly to the patient's chest. In other words, it was direct auscultation. Laennec was the first who used medial or indirect auscultation when he rolled a paper into a sort of cylinder and applied one end to the region of the heart and another to his ear. Laennec described this cylinder or this first tool for auscultation in his book Mediate Auscultation in 1819. And 3 years after, Laennec first used his roll of paper. The book introduces the stethoscope and describes as never before the audible sounds of thoracic disease. It is also a result of 18 years of study by Laennec in the clinical aspects and pathological anatomy of disease of the heart and lungs. Because Laennec heard sounds no one else ever had, he established the new terminology such as rales, bronchial breathing, bubbling, and etc. In the Museum of History of Medicine of the University of Paris, you can see the couple of original stethoscopes belong to René Laennec. In this picture, you see also these two inventions, and one of them is wooden. Another is, which is in front, is that rolled paper, and which was described in the book Mediate Auscultation in 1819. These vintage pictures, they show immediate auscultation, and they belong to the beginning of the 20th century. Despite the stethoscope was invented in the 19th century, but many of doctors, they used immediate auscultation even in the 20th century, but it was risky as the physician had a very close contact with an infected person. And here you see the picture which belongs to the beginning of the 20th century. The physician used monaural stethoscope, and it's remained in the use until 1940. Here you see mediate auscultation with modernized tools, modernized stethosphonendoscopes and phonendoscopes in general medicine and in pediatric practice. The main rules of auscultation are the same as those in percussion. First is preparing environment. Environment must be quiet, and areas of auscultation requires to be exposed. Positioning of the patient must be comfortable for both doctor and patient. The procedure of auscultation consists of the following steps. Ensure your stethoscope has been cleaned. Discuss the procedure with the patient and gain his/her consent. Check that the patient kept warm and the area is free of drafts. Wash your hands. Warm the stethoscope between your hands if necessary before applying it to the body. Hold it between the index and middle finger of your dominant hand. Place the stethoscope flat on the patient's body using gentle pressure. Explain your findings to the patient. Clean your stethoscope, wash your hands, and record findings in the patient notes. And in conclusion, I would like to remind you what we learned today. Definition of health and disease, overview of the basics of medical ethics and deontology, and principles of clinical examination. Don't forget that physical examination is a key part of continuum that extends from the history of the patient to the therapeutic outcome. If the history and physical examination are linked properly by the physician's reasoning capabilities, and if the physical examination, a strong link in this chain, is performed in an appropriate manner, you could yield positive results in management of patients. Thank you for your attention.